but it is also spurring a closely related mental health crisis. Dr. Simon Rego is the chief of psychology at the Montefiore Health System in New York. Dr. Rego, welcome. Good to have you with us. I'm sure, I want to get to two things here. I'm sure that there are immense amount of stresses owing to the COVID situation and the illness. But what's coming down the pipeline, it would seem to me, would be a lot of stress related to economic stress, and that you're going to start to see a wave of patients and a wave of emotional behavior that's economically related. Am I right about that?
Well, first of all, thank you for having me on. And yes, I'd say you're exactly right with that. As this starts, you usually think of it like a stone dropping in a pond, where at first we're dealing with the crisis at hand, and that was clearly the virus and how it's being spread and the medical consequences related to that. And then as that wave is passing through us, what's left in its wake are usually all of the consequences from having dealt with that in the short term. So these are not only the health-related consequences that people in recovery are starting to deal with, but also, as you said, the economic consequences, the consequences of having been socially isolated, and all of the other consequences that result in the aftermath of something like this.
I'm guessing that with respect to COVID and the anxiety that it has spurred in communities across the country, and maybe most especially right where you live and work, and in New Jersey where I live and work, that the anxiety is very high, but that people may be hesitant to seek treatment because they're A, afraid of going out, they're B, afraid of going and sitting in a waiting room or going to a hospital for that, and that maybe the anxiety is being suppressed and that you may see a blossoming of it down the road. Is that happening? Is that what you're seeing, or what?
Yeah, it actually lines up pretty much with what we're seeing, at least in our hospitals here, where I think the other side of it is I think people are doing their best to maintain social distancing and trying to follow guidelines and staying safe and staying home. So the physical clinic numbers don't look like they've changed thus far that much. But if you look at polling numbers, or if you look at utilization of things like national hotline services or state hotline services, or even sort of online applications of teletherapy, those are all certainly seeing surges in numbers. So I think you're right. I think people right now are staying in more and utilizing the services available to them remotely. And then potentially as things loosen up, we'll start to see more of the foot traffic coming back into the clinics and the numbers that you might predict.
You just answered the question that was on my mind, and that was, have you begun using, and in a big way, telemedicine? I can well imagine that therapy and mental health therapy would be one of the areas where telemedicine could be extraordinarily effective.
You're exactly right. And in fact, in a lot of ways, fortunately, this had been looked at now for a number of years as technology improved and advances were made and applications were broadened. We've actually been studying the sort of transition of traditional teletherapy sessions into online and application formats. So we have data that says it can be effective, and we have resources available now that we were able to implement and actually transition quite readily into a telehealth platform.
What does history tell us, doctor, about what happens to people's emotional health, to their anxiety levels, to social acting out in a stressed economy where job losses are high and incomes are wiped out? What are the lessons of history there? What happens? What are we up against mentally?
Yeah, well, unfortunately, the news isn't so good there, because if you use modeling from previous events of this magnitude, you see an exacerbation of pre-existing conditions in people of things like anxiety and stress and depression and anger and all of the difficult emotions people are already contending with. And then they get amplified when you have economic stresses or medical health stresses or social isolation and restrictions in freedom. So it compounds things, and people become at higher risk for things like greater depressive episodes or increases in problematic coping strategies like substance abuse and misuse. And even you see some correlational data that suggests people are at greater risk for increased feelings and thoughts about suicide and life not being worth living as the
Right.
economic impact is felt.
Quick final question, quick final answer. Are you bracing for a rise in stress, or maybe you're already seeing it, a rise in serious stress reactions among the practitioners in your health system, the doctors and nurses who have seen death and illness on a scale they probably have never seen before?
The answer to all that is yes, and we're ahead of it. We've launched initiatives that are reaching out to the providers before they even come to us so that we can let them know you have an ally here. We're doing it on a one-to-one basis as best we can with all of our providers on the front lines so that they know when it settles down medically and the pressure's off and they start to feel the impact, they've got a direct person to contact so that we can help identify problems before they start to get too intense.